everyone. A very good morning to all of you. I'm Saintha from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They look like freckle-like spots forming large flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to study conducted across four Indian cities reveals that more than 80% of the population presents skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this very common hyperpigmentation issue. This can lead to frustrating setback in treatment, and thus, to avoid all these hassles and to keep you informed, today we are here to know more about the management of melasma from an expert. So let's connect today with our skin expert, Dr. Shri Sindhuja from Chennai. She has done her MBBS from Sri Ramachandra University, followed by MD D.V.L from Sri Balaji Medical College and Hospital, Post-Doctoral Fellowship in Cosmetology, Government Stanley Medical College, and Diploma in American Academy of Aesthetic Medicine, USA. An enthusiastic dermatologist with special interest in aesthetic dermatology, with training in dermatosurgery and cosmetology, Dr. Shri Sindhuja is able to perform procedures and whatever it is required with great acumen and skill, with focus on the pre-existing health conditions and understanding the patient's lifestyle. She aims at treating conditions related to skin, hair, nails by providing personal attention to each patient while targeting the root cause. With lifestyle modification, affordable medication, and easy to follow skin hair care routine. With her expertise today, she will enlighten us more on melasma and its management. Thank you so very much, Doctor, for joining us today. We are delighted by your presence.
Good morning. Thank you for that lovely introduction.
So, Doctor, today we are going to talk about melasma. And as I have already said initially, that melasma is a very common skin condition, especially in women in our society, in our country. What is melasma to start with?
So melasma, as you have already mentioned, is a pigmentary condition, most common in darker skin types. It is multifactorial, which means the causes are vary from person to person, and it cannot be contributed to one particular cause. Like it can vary with many causes like excessive photo exposure, drug induced, pregnancy induced, and also tendency to react to sunlight more than the others.
Right. So there can be n number of things causing melasma. There is one more term, doctor, hyperpigmentation, and that is a quite common, or people know this term, pigmentary issues or hyperpigmentation. So, is there a difference between melasma or hyperpigmentation, or are they the same?
So the thing is, hyperpigmentation means concentrated melanin or increased melanin secretion in a particular area. One of the results of hyperpigmentation is melasma. So hyperpigmentation can be due to many other causes. Hyperpigmentation is just a broader term to say concentrated melanin secretion in a particular area. But it can be freckles, it can be lentigines, it can be general skin type, or one of the results is melasma.
Right. So hyperpigmentation is an umbrella term, we can say. It's a broader term, and melasma falls under it, right? Why it's so common in our society, doctor? Why we see so many cases of melasma, especially in women in our country? Are there specific reasons for that?
I would mostly contribute it to lack of awareness of usage of sunscreen. People often understand that usage of sunscreen is only when they step out. They don't understand that sunscreen is just a term, but it's basically to protect you from any photo exposure and even heat exposure. So even staying indoors, you need to use an effective SPF, a sunscreen that has effective SPF, so that it protects you even from indoor illuminating agents like light on the ceiling, phone, laptop, TV, people often forget, and because there's lack of awareness, and they end up using sunscreen only when they step out.
Normally, because the term itself is sunscreen, so we feel that sunscreens are only when we are out under the sun or we have some sun exposure. But as you said, that the lights that we have in our houses, offices, etc., the screens of laptop, mobile phones, they are equally damaging, right?
True.
And that makes it even more important to apply sunscreen even when we are inside. Now, doctor, you said effective SPF is something which is one should look for when buying a sunscreen. What are the basic things that one should look for when going and buying a sunscreen? Because there are so many information on the box, on the tube, right, starting from SPF, etc., etc. So, what are the basics that we should look for?
The basic things as a dermatologist, what I would suggest is look for the SPF. It needs to be 30 and above. 50 is ideal. But anything more than 50 doesn't really promise you tremendous increase in protection. But SPF, anything above 30 is ideal. It needs to say PA plus plus plus. At least three pluses should be on that. An ideal sunscreen is something that is a good combination of physical and chemical sunscreens. Physical sunscreen is something like titanium oxide, iron, all these physically remain on the skin and help to reflect the sunlight or any photo exposure that happens. But a chemical sunscreen is one which mingles with your skin and then it absorbs photo components and then reacts to it. So a good sunscreen needs to be a combination of both. So
If
with
somebody has a sensitive skin, many a times there are people, and now the number of people with sensitive skins are rapidly increasing as well. Now, what do you recommend for that then?
so there are two things. There is a sensitive skin and there's a sensitized skin. Most
Mhm.
often we are misinformed and all of us think it's sensitive skin, but it will be sensitized skin because of all the over the counter skin lightening medications and all that people end up picking. They would have sensitized the skin. When that happens, a good moisturizer to combat and work with the skin's immunity, make the skin barrier stronger, and then you can always use the sunscreen.
Right. So nowadays, because market is flooded with skincare products, and there are social influencers, over-the-counter medication or products are so easily accessible. So that is also one reason you're saying that is making our skin, sensitized. We get redness or rashes so easily. So yeah, we should stop experimenting, I guess, with products. And in case we want to buy something for us in terms of skincare, as you said, you need a good sunscreen. Sunscreen is really recommended. Now, can I go to a dermat just to seek advice for good skincare routine or the products I need to buy, or what is my skin type? Because of course it plays a vital role in choosing the right products. So can we go and consult a dermat for that?
So all of us are educated not to just address a skin concern, but also to maintain a good health. Like how we go to a doctor to even get a general physical health checkup, right? We
Right.
don't get a physical checkup because you have a heart attack. So it is wise to consult a doctor just to see we are on the right track, and we're always available to suggest what is good and what to stay away from.
Right. So, in case you're confused, you don't know what is your skin type, you are not being able to decide about the best skincare products or sunscreen, you can simply go and consult a dermat, a qualified dermatologist. Now, the thing is, doctor, I'm sure you will also agree with me. First thing that we normally do when we see something which is not normal on our skin or scalp or hair, etc., is to go inside the kitchen, get something from the kitchen and apply it. Dadi ka nuskha, nani ka nuskha, they all comes to our scape. Then we have over-the-counter medication. Nowadays, we have so many influencers, and these social media influencers have, quick fixes. They have answer to almost every question, even if they are not a qualified doctor, dermat. etc. What's your take on that? In case we start, seeing these spots or signs of melasma, is it a okay practice to go for home remedies or over-the-counter products, or what the influencer is saying, or we need to go and immediately contact a qualified dermat like you?
So what happens nowadays is they don't immediately go into the kitchen. They end up Googling. Google is the first
Right,
thing we go for. And then comes the kitchen. So it's become that the order has changed. So before
right.
even Googling, I would suggest first Google who's the nearest qualified doctor who
Mhm.
specializes in that particular concern. Because even any doctor might address this issue, but only a qualified dermatologist will be able to give you a long lasting result. So one is stay away from home remedies. Whatever belongs to the kitchen can go into your tummy but not on the skin. Most of these kitchen made home remedies are irritants. They increase your sensitivity to photo and any light exposure. So you might end up complicating things rather than bringing a cure to it.
Right. So, in case you are going and taking the help of the internet, then please use it for the right thing. Go and find out who is the nearby, dermat who have good reviews, etc. So you can just go and contact them. Another thing, doctor, I would like to discuss is the accessibility to the chemist shop and how easily over-the-counter medications are available, and that's our next, rescue point. The next thing other than googling is that we will go to the chemist shop, ask the chemist that we need something, I mean, I'm getting these spots, whatever, and we start using the creams or whatever the chemist normally provides us. It's only after a certain point of time, because initially these creams, most probably because they have steroids, etc., they work like magic on our skin, but only after using it for certain time we realizes that it's not the thing. My skin is getting addicted to it, or the moment I stop using it, I'll start having other complications. So what's your take on these over the counter medication or creams?
So most of the over-the-counter medications, as you mentioned, contain steroid. Steroid, when applied with a retinoid or a skin lightening agent, what happens is absorption becomes more and the irritating component of the other agents are masked by the steroid. But in the process, what happens is you start seeing results quickly, but steroid tends to thin out the skin. There are many other complications like more increased striae wherein the collagen breaks down. These are permanent changes and these are irreversible changes. And people often forget when they go to a pharmacist, they are not aware of such complications and they end up just giving you anything that has a steroid, so you immediately see skin lightening benefits. But it's very, very dangerous and you should stay away from anything other than a prescription grade product after getting a prescription in your hand.
Okay. Now, coming back to melasma, our, root topic, what are the signs and symptoms of melasma, doctor?
Ideally, melasma is asymptomatic. Patients' only concern would be whenever they look at the mirror, there's a pigmentary spot on the face and it's becoming more and more.
Mhm. So it's not a over the night procedure, right? It will gradually increase. So we can try and consult a doctor and get it restricted or controlled at the very initial level, right?
True, very true.
Okay. And who all are at risk of getting melasma? What are the risk factors, doctor?
People who have increased exposure to screen, exposure to outdoor light, unprotected photo exposure basically. And
Right.
also, darker the skin type, you're at an increased risk because that's the skin's way of reacting to any photo exposure. That's how the melanin secretes. It thinks that it's protecting the skin and it will start replicating.
And we see a lot of women suffering from it specifically. So, what are the reasons in women getting melasma?
Hair dye usage,
Okay.
and people tend to, like how I mentioned, people tend to forget turmeric as such. When you apply and stay indoors, it is a very good maintaining agent, a potent antioxidant. But once you apply turmeric and step out, it's a photosensitizer. It increases your tendency to pigment once you step out wearing turmeric. So like this home remedies that we've just ignored and we just continue to use, like using lemon on the face, all these increase our tendency to react and increase our tendency to pigment.
Right. Women also get melasma when they are pregnant. I mean, many of them do. Right. So, does it fade away after the delivery postpartum, or it remains, or we need some kind of, treatment for that as well?
So pregnancy-induced melasma is called cloasma. It usually fades off, but in 10 to 20% of the patients, it does stay back. That's why even in pregnancy, safer agents like azelaic acid are safe to be used so that you maintain it, you don't make it worse, you don't let it progress to a level where it becomes really psychologically threatening for you, so that their self-esteem is also not damaged, so that after delivery we can effectively target it even in a more aggressive manner.
Right. As you said, that sunscreen usage is really important, especially in case you are, photosensitive or you are having melasma, etc. Sunscreen, anyways, is very important. But then we know that when a lady is pregnant, many a times we see that sunscreens also come with warning that in case you are pregnant or lactating, you should seek advice from your doctor before using it. I'm sure during pregnancy, over the counter medication is a big no no. Anyways, it's a big no no, but especially during pregnancy, you just don't risk that. But, then what are the other ways pregnant women can, go for? What are the other options that they can take to keep their skin sun protected, other radiation protected, and also which is safer for her during her pregnancy?
So the thing of mineral sunscreen is being overly advertised. There's no evidence, there's no journal, there's no study substantiating that applying sunscreen on a controlled surface area, like this is just a 10% of your body surface area, and applying on 10% body surface area is not going to contribute to systemic absorption. And even then, when you apply it on your arms and on sun exposed areas, it's not like we are wearing a bikini and applying it all over the body. So just to apply it on a small surface area, you don't have to worry too much. One.
Yeah.
Another thing, there are journals and studies substantiating azelaic acid to be safe. And also oral antioxidants like potent agents like amla and vitamin C containing fruits like papaya. All of these can be incorporated in your daily diet so that diet wise also we are substantiating and being protective.
Right. And in case of any doubt or any problem, you can definitely go and consult your doctor, your dermat. They'll be definitely there to help you out. But the only thing is that please do not go for over-the-counter medication. If you are pregnant, that's a big no-no. Otherwise, also it's a big no-no. So please go and consult the right person, which is a qualified dermat, in case it is associated with your skin, your hair, your scalp, etc. Now, doctor, when a patient comes to you, are there tests to diagnose whether it's melasma or not, or just by physical examination, you can say that, yeah, this is melasma? Or are there tests to see, how deep it is or how, bad it is, what stage, etc.? So, what do you do normally to diagnose
Ideally,
melasma?
yeah. So ideally, melasma is a clinical diagnosis. Unless and until it's been there, we see that it's a complicated case. We don't ideally test it like skin biopsy or dermoscope. It is a clinical diagnosis, and it's pretty easy to differentiate between dermal and epidermal melasma. That only proves the way of management only differs depending on the depth of the pigmentation, because if it's a dermal melasma, it needs a more targeted approach like a laser. If it's an epidermal melasma, it's going to fade off with just topical creams. Only in this manner an investigation is required, otherwise it's purely a clinical diagnosis. So we don't really do any investigations for melasma.
Mhm. And does hormonal, disbalance or they are also responsible for melasma?
Yes, so one of the causes for melasma is hormone imbalance. Even hormone pills can aggravate. I wouldn't say they cause melasma, but if you have a tendency to form melasma, it becomes more.
Okay. And what are the treatment options for melasma, doctor?
So starting with sun protection, so that we first control the damage. so that whatever we treat doesn't has visible results. So start with sun protection. Even oral sunscreens are being given, and then go on to educate the patient about controlling photo exposure whenever they can. Even sitting in front of the laptop, please use a sunscreen. And also, whenever they go, nothing like a physical barrier. Cover yourself with a dupatta or a scarf or an umbrella, a cap, coolers. All of these aid in controlling the disease first. Then, to treat whatever damage that has already been caused, there are effective agents like kojic acid or alpha arbutin and so many agents in the market to treat to cause depigmentation. And also, there is potent agents like retinoid which help us get that result faster.
Right. So there are various ways, but definitely prevention is always better than cure. And to prevent, you need sunscreens and physical sun barriers also come at your rescue. But yeah, sunscreen is really important for your skin. But the fact remains that, 67% of Indian population is still not using sunscreen as a regular thing. And as you said, many a time we have this notion in our head that, sunscreen is only to be applied when we are stepping out. Then people have all kinds of excuses that it makes my skin very oily or patchy or dull. I don't like the feel of sunscreen. Or when, those who are acne prone, they'll say that I already have so many acne, I don't want to layer them up with sunscreens, etc., etc. So many complaints, excuses regarding sunscreen. How to combat that? What would you like to say about that?
There are many lovely products out in the market now. So, especially when you have acne, opt for sunscreens that say non comedogenic. And when you have an oily skin, there's always dry touch sunscreen. Like you won't feel they leave a matte finish. And some people really love that oily texture. When they have dry skin, they want that oily sunscreen. So there are many combinations. So it's like really you'll have to like try out something, stick to it for at least 45 days before switching.
Right. And it is also said that the amount of sunscreen you are applying, the way you are applying the sunscreen, reapplication of sunscreen, they all are equally important. We would like you to shed some light over that as well, Doctor.
So ideally for the face and neck, we say 2 finger long. But for our skin type and this humidity, especially in Chennai, it's impossible for us to apply 2 finger long and step out. We will look like ghosts. So what I tell my patients is, as soon as you get up, like when you brush your teeth, please apply 1 finger long of the sunscreen all over your face and neck. And after 2 to 3 hours, when it's already set, because the skin has indentations and curves, so it gets deposited in those depressed areas. So after that, if you still feel oily, just dab with a tissue and then apply another finger long. So ideally, it's just an add-on, so that it's more aesthetically pleasing, so that they don't totally stop using a sunscreen.
Right. Many a times when we go out for vacations and all, for beach vacations, we all, use sunscreens. We'll keep a sunscreen. But when we are going up hills or mountains, etc., we normally feel that it's going to be really cold there. No need for sunscreen. But what's the fact, doctor? Do we need to apply sunscreen even if we are uphill or in the mountains?
Yeah, so no matter we are, as soon as you wake up, just apply a sunscreen, because especially when you're uphill, the altitude is higher. The incidence of that falls on the land is even sharper. So you're going to tan even more, especially when you're in snow, it's going to reflect right onto your face. So you will tan even more. And being cold, your skin's tendency to be moisturized and your skin barrier is anyway going in for a toss. So it's important to ideal, even if it's raining, please apply a sunscreen. Even if you're near the snow, apply sunscreen. Even if it's a hilly, cloudy region, please apply a sunscreen.
And is melasma a hereditary condition?
Not really, although your tendency does prevail, but it's not ideally an hereditary condition. If your mother has, doesn't mean you'll definitely have it, but it definitely gives an edge. You are definitely prone to develop
And
melasma.
in that case, what can one do? For example, if I have a family history of melasma, that what I can do to prevent it or at least prolong it?
Same.
Using sunscreen?
Yes. Orally, start taking antioxidants. like incorporating mint, cucumber, and we have lovely variety of vegetables and fruits that are potent antioxidants that we can incorporate in our diet every single day.
True. Right. So we can incorporate that healthy lifestyle, a healthy thali, a healthy plate of meal is really something that will enrich us. Now, Doctor, we would also like to ask you that many a times a very general question that people who are suffering with melasma ask that is it going to permanently cure or am I going to get complete rid of it? What's your take on that?
Melasma, to tell you the truth, is a very resistant, hard to treat condition. It is easy for us to make it go away, but if you don't maintain your skin as soon as it goes, it's gonna come right back up. So it's treatable, but we always need to keep applying agents so that we maintain the skin so that it doesn't come right back up.
Right. So I think the bottom line is that A, we need to use sunscreen regularly, religiously, in the right way, etc., etc. B, as soon as we spot anything on our skin, which is what not normal, we need to go and consult a qualified dermat. And C, trust your doctor. That's really important. Even if it's taking long, please stick to what your doctor is advising you and complete your medication. Procedures are also there, I'm sure, Doctor. And we have one viewer, John Vergis, who has a similar question to us. Is it safe to undergo cosmetic procedures for melasma, such as chemical peels or laser therapy?
It is. It is absolutely safe provided you are getting it done by a qualified dermatologist and not a dentist or not any other specialist who are just temporarily trained to be technicians.
Parlors and saloons, they also
Really
claim to
scary
have these
because
therapies.
number one, they don't know to the depth that they are damaging. So chemical peel as such is a controlled damage which can give you favorable results when done right. Even lasers. So if you don't get it done by a qualified personnel, then you might end up damaging and not get the adequate results that you were hoping for. Otherwise, if it's done by a qualified dermatologist, a chemical peel and laser therapy can give you permanent freedom from melasma.
Mhm. Does sunscreen, falls under the procedures also while doing these procedures? Also, you ask the patient to use and apply sunscreen regularly because, again, it makes our skin very sensitive that way, the peels, etc. So, does sunscreen fall into that bracket as well with all the importance?
It's an adjuvant, so we definitely start our prescription with a sunscreen. But
Mm-hmm.
we also educate them about how religiously they need to be using the quantity and the frequency of reapplication because that's equally important.
Mm. There are many women who are, not going out, don't work in front of a laptop that much. They are in the kitchen most of the time, and they'll, again, use this as an excuse that I'm just working in my kitchen and I hardly step out. Why should I use a sunscreen? But then we see a lot, many, such women's having this condition, having melasma. What could be the probable reason why it's so important for even those women who are in their kitchen most of the time to use sunscreen regularly?
How I mentioned earlier on in this live video, even any heat exposure triggers an alarm in the skin, so the skin proactively starts secreting melanin. So even exposure to heat is important. So you need to protect yourself even when you're cooking in the kitchen. Apply a sunscreen before getting into the kitchen.
Okay, so yeah, that is one of the reasons. And yeah, definitely, even if you are in the kitchen, please apply sunscreen no matter where you are. The moment you get up, the moment you brush your teeth, as the doctor said, you need to apply sunscreen as well. And reapplication is equally important. Now, for example, yeah, we are in such a profession where we have to use makeups. Makeup is mandatory. When to use sunscreen? What should be the chronology? What should be the normal or basic skincare routine plus the where to use sunscreen, doctor?
So depending on your skin type, ideally start with a cleanser, face wash in the morning, plus or minus moisturizer, and then the sunscreen, right? So after the sunscreen, you can use a primer and then step onto a makeup application. All those procedures will fall. But when you remove at night, remember to double cleanse.
Okay, what's double cleansing?
As in, one, you can use a micellar water or a combination of a cleansing balm like that, and then you follow it up with a cleanser. That way, most of our makeup is oil based.
Hmm.
A sunscreen ideally can be washed off with any face wash. That's one of the tests for a sunscreen to be given get go. Like before it comes to the market, they do all this cleansing test and all that, wherein the wash off of a sunscreen is also studied. So with a face wash, a sunscreen can be washed off, but a makeup cannot be washed off like that. No matter how many times you wash your face with makeup on, you wash your face with a face wash, definitely 10 to 20% of your makeup will still remain. Although it may seem clean, there is still some amount of makeup that gets left. That can also provoke and cause pigmentation. That can also provoke and cause acne. That can also provoke and cause a lot of allergic reactions. So please use a micellar water or any oil and water combined makeup removers, and then use a cleanser to remove it off. And also, when you're applying makeup, don't forget to reapply sunscreen. It becomes difficult, and you have powders and sticks nowadays to top up.
Right. So it's really important to take care of your health, to take care of your skin. Skin is the largest organ of our body, and it also reflects, it's a mirror to our health. So whatever is going inside will be reflected outside. So you need to keep yourself healthy, adopt a healthy lifestyle, stay stress free. And in case of doubt or in case of any problem, you just need to go and find right expert, which is a qualified dermatologist if the problem is related with your skin, your nail, your scalp, your hair, etc. We have Kirti Kapoor with us. Her question is: are there specific triggers that I should avoid to prevent melasma flare ups?
So ideally, like melasma doesn't have flare-ups like acne or rosacea. It's always a downward or an increased curve. Like before a travel, you prep yourself with a diet rich in tomato and oral sunscreen. So such can help you reduce the increase in melanin buildup. But as such, melasma flare up doesn't happen because melasma doesn't happen overnight. It's a cumulative insult. So it gradually happens. And to make yourself stay away from such rebound, stick to your prescription grade products. Go on time to the doctor for a review. Stick to it. Maintaining your skin is of utmost importance because that's reflecting you.
Right. Many a times we have already talked about it, but again, because it's a very important issue to address, we see, products in the cosmetic shops claiming that they will lighten our pigmentary disorders, or, there are people who say that use papaya or use, fruits like these on your skin. I've literally seen people rubbing lemon on their skin, on their face to get rid of the pigmentary issue now, and people go and follow these, and the outcome is really bad. So when a patient comes to you after almost trying everything and ruining their skin or the protection bar of their skin, how difficult it becomes for you as a doctor to treat the patient.
So then it becomes more of addressing the allergic and the damaged component of the skin. So
Mhm.
first we need to work on their skin barrier. So it becomes more difficult to give them a promised result because the skin has already been compromised. So then we work with it, we make the skin barrier more potent, we make it stronger before we target the pigmentation. So then the pigmentation control comes last. First comes addressing the consequences, the complications that all their home remedies has caused. So we work with them, we give them potent moisturizers with ceramides and urea and things that have peptides so that we work with their skin barrier, address the concerns, and then melasma comes last then. It comes like a phase two of the treatment.
Okay. Now, as you're continuously saying that sunscreen application is really important, and again, there are so many things that people normally say about sunscreen, like it's winter in almost all parts of India, and people will generally stop using sunscreen, saying that it's cloudy, it's hazy, sun can't be seen, or okay, I'm not working that much in front of a laptop, or my screen time is not that much. Plus, there is no exposure. Do I still need to use sunscreen?
You do. All of us need to do.
Mhm. Right. So sunscreen is the one thing that we
Just
cannot.
to give you a hint, I
And
would
I have
suggest
actually heard that
moisturizer.
sunscreen is like a best, anti-aging cream. They also take it as an anti-aging cream. Why we consider sunscreen to be an anti-aging cream as well?
When we adhere to a strict sun protection, your tendency to break down collagen comes down. So number one sign of aging is pigmentation, and number two is fine wrinkles. So using a sun protection can delay onset of these.
Right. So that way it becomes really important to use sunscreen, not even to get rid of melasma or have a, sun protected skin, but also to stay young or prolong your aging, etc. Now, before we sum up the whole session, doctor, what are the, take home messages or do's or don'ts that you would like to um, tell to our viewers?
Nothing like a good diet. So start with your gut health. Improve intake of fruits and vegetables. Start with at least 1 to 2 fruits a day. Hydrate yourself. Hydration is the key. No matter what creams we give, nothing like improving your intake of fruits and vegetables and water. Number two is strict sun protection. Number three is opt to use actives only after consulting a dermatologist. An influencer is someone who can suggest what outfit goes with what, but they cannot ideally suggest you what skincare to go with. If you have pores, you use this. They are not certified in that. So please educate yourself who to sought advice for which problem.
Right. So it's really important to consult the right person. So don't go for the influencers in case you have anything to do with your health. Please go to the right person. Please go to an expert, which is a qualified dermatologist, in case you have anything to do with your skin, your scalp, your hair, your nails, etc. So please go and take the right advice and trust your doctor. That's really important. Thank you so very much, Dr. Shri Sindhuja. It was wonderful talking to you. Thank you for all the insights. Thank you. And we really look forward, in having more such sessions with you in coming times for our viewers.
Thank you. Thank you so much. You are a lovely host. Thank you for making it such an engaged and interesting session. Thank you.
Thank you. It was a pleasure. And viewers, thank you for your active participation. Stay in touch, stay spotless, stay glowing, stay happy, and stay healthy, and stay connected with us. Thank you. Have a good day ahead. Goodbye.